Hi, I'm Dr. Elkowitz, and I'd like to share with you one of my favorite cases. And why do I say one of my favorite cases? Obviously, we want everyone to be happy and everyone to have a perfect result. But sometimes there's a particular patient that has a particular disposition or attitude that's just contagious. Sometimes a patient has a really significant problem and we get a wow result. And I think in this particular patient, we kind of got both. She's a 64-year-old patient, and she had what I consider simple aging. She's, pushing 65 years old. She had a lot of extra skin and redundancy on the neck. Her upper eyelids were overhanging and droopy, and her lower eyelids were puffy, and she was just unhappy. So what she got was a very common, almost classic cosmetic operation: upper eyelid surgery, lower eyelid surgery or blepharoplasty, and a face neck lift. And you see that her results are what I think to be amazing, and equally or more importantly is she is just over the moon happy. She's having her friends call us, and she's just really over the moon, and a great reflection of our practice here. You could even look closely in the photos. The incisions are almost invisible. The face and the neck is just a small incision near the ear, and then the rest of it goes behind the ear. The eyelid incisions heal up to be nearly invisible. We do a little bit of fat injections in here. If you've been researching this kind of operation, I know that I think in the old days, and patients always have a concern that they don't want that wind tunnel look or that overpulled look. And in the old days, in the 70s, you saw a lot of that. And that was because to get a lot of the wrinkles or the nasolabial folds, the wrinkles down here, we call that jowling or marionette lines, to get a lot of that out or to make that gone, you had to pull everything really tight and pull everything back towards the ear and back towards the scalp, and that the more you pulled on those wrinkles, the more they looked like they were going 100 miles an hour down the highway, and that wind-blown look. We've gotten smarter and better at these things over the last decade or two, and what I find to be incredibly helpful is combining a face and a neck lift with fat injections. So what I do is I do things in a similar way that most surgeons do, and we get things much better. We reposition everything where it's supposed to be. But if we have still some irregularities down here or some deep wrinkles in here and we want to reverse that, I'm not going to pull tighter. I'm actually going to just pull enough and then fill in those areas with the patient's own fat. Very often we have to do a little bit of liposuction on the neck anyway to give that kind of 90-degree neck or that cut neck appearance, and we take that fat, we don't throw it out, that's gold. We actually save it, and then at the end of the case we inject it in areas. It mimics kind of like the fillers, the hyaluronic acid fillers that people use, but when it's your own fat, the fat that takes and lives and works post-operatively, for the most part stays with you forever. So we reposition everything on the cheeks and the neck, and then I call it the icing on the cake. At the end of the surgery, we just do and fill in those little areas that we would have otherwise had to overpull. We're here in the operating room, and you can see that the patient is asleep, comfortable, not feeling anything. Make those incisions mostly in the scalp, some incision around the ear, and that's where we tuck everything in and tighten everything. And that's what gives us a great result. You could see here we're doing upper and eyelid surgery. The incisions are relatively small. We remove a little bit of skin, more skin on the upper lids, a little less skin on the lower lids, or sometimes no skin on the lower lids, and we go after those puffy fat pockets. A small amount is removed. a little bit of cautery, and when you combine removal of the fat pads and cauterization of the fat pads and removal of the skin and kind of readjusting things, you get a great natural looking cosmetic result.
April 24, let's say we're talking about like 3 months, so 3 months ago. We do my eyes, we do my shade, and we do my neck, and we do my lip, my face around next to my nose. I feel great. I feel great. I feel very good. I feel like 30 years younger. Yeah, I do it again. I do it again. This is the experience, the way you look. Yes. Oh, this is so. I don't have no. The way I think, oh my God, I'm very in shock the way I look now. And the way they talk, the way I look, I say, oh my God, they're surprised. Oh, I have feel that my client, my client before, about my business before, they show me, I said, Maria, what are you doing? I explain to them where I do it, and they want to come in. They want to do it. I got to. Yeah. They see the difference. They say, I want to do it. I'll let you know when I'm ready. I say, okay, no problem. That's what I want to say to my daughter too.